Wikidontist.com. Truth about tooth.
Habits are something which all men develop. There are good habits, there are bad habits. Good habits will help you to keep your health very well, but bad habits all can deteriorate your health as well as your dental health. So now today we are going to talk about some of the bad habits that are developed in human beings and that has really caused trouble to the tooth. So watch the whole video to understand whether you have some bad habits. If you have seen somebody having that bad habit, please send this video as a gift to them so that they stop the habit and then they have very good teeth and have a great smile. So what are the bad habits that can happen? One is basically nail biting. You might have seen your parents or somebody telling that you should not bite the nail, and you might have wondered what is the problem in biting the nail. But the problem with biting the nail is that it is actually it is bad for the nail, it is bad for your stomach, because it will take all the bacteria from your wherever you have touched and you will eat it. So that is one part of it. But for the tooth, you will be pressing it onto the tooth and then you might be biting the nail on one single tooth. That is how most of the people do. So what happens is the pressure on the tooth, which is regular, most of the time you will be unknowingly biting the nail and also the skin over that area. So what happens is there is a lot of pressure on that tooth and the tooth can move to one point to the other. So you can get a malocclusion or a crowding depending on how much pressure you are going to put on it. So that is one reason. The other thing is it can get worn off. The tooth gets worn off, and that also reduces the size of the tooth when compared to the rest of the tooth. So look out of the whole group. So it is an unsightly thing that the tooth is moving somewhere, and also it is shortened because of the continuous use which is used for nail biting. So that is one of the reasons. Then the other reasons by which the enamel is taken off is actually bruxism. That is not knowing you are biting too hard on this thing due to stress and some of the reduction of the enamel on the anterior teeth due to maybe it is broken, maybe it is because of some habits you might have lost the enamel on the front teeth. So what happens is the front teeth gets worn off, and that causes no response. Like since when you bite there is not enough force, the nerves will show as though that the nerves will tell that the tooth is not touching. So the mouth will open once again and then once again try to close. Still the nerve will not say. So what happens is this goes on happening until the tooth gives some amount of response so that the cycle is stopped. So it is like opening, and then once it closes, it's like a robot, it goes on and on. So that causes bruxism, and the person tries to bite it really hard so that the response is elicited. But sometimes what happens is, since there is not enough bite, it keeps on happening. So it will actually take off all the back teeth by grinding to each other. So that is called as bruxism, or that is the way the tooth gets worn on the back. So that will also reduce, you might have crevices on your there will be wrinkles and crevices on your face. You will have anteriors which is actually flattened, which you will look as though you are very hot tempered and you are not at all kind at all. You might have seen people who are very angry, they have all the teeth which are flattened. So you will have a gory picture. So if it is like that, then we can correct it also. I will be coming in with the treatment portion of it in the next video. Now what else is bad for you? There is something called as tongue thrusting, wherein the person presses the tongue onto the tooth, and or if there is a less pressure of the lip by keeping the mouth open all the time, then the tooth can move forward, and also it can also have a gap between the upper and the lower teeth called as the open bite. And then what happens is, even when you speak, there will be a lot of saliva which is coming out Open bites also is an embarrassment because you cannot bite on some things in the front teeth. Like if you give an apple to them, they'll not be able to bite in front. And when they smile, they always have a sad face because your smile arc is actually a arc which goes up, but what happens is the tooth will have an arc which is actually the other way around, so it looks very bad. When he is trying to smile, you will still feel as though he is actually very sad. So this is also another problem, so that also can be treated and got corrected, but I'll talk about the treatment later. Now the other reasons why you can lose the enamel is basically using of needles or holding the needles by a tailor, or you might be a person who tries to open a bottle which without the bottle opener, you might be using the teeth. Please don't do that. You might chip off your enamel tips, and if you do it regularly, you might have a very shortened tooth. So that will also once again cause bruxism and other troubles on to this thing. If there is a lot of bruxism and if there is a lot of enamel loss, then what will happen is it will slowly merge into TMJ problems, or your temporomandibular joint problems also may kick in. So all this hard stuff like metal and wires that has to be peeled, all these things you have to use the right tool rather than the tooth, because tooth is a very good tool, but it should not be used as a tool because it will give you very sharp teeth. It might chip off your enamel. It will give you other problems like TM problems or temporomandibular problems, which will be a very big nuisance for you. Then it will also reduce your ability to smile properly, because having a rugged tooth edge is not a great sight when you are smiling. So these are some of them. Then there are other habits like smoking, like pan chewing and all those things, which is actually it has two problems. One is the heat. When you are smoking, you have a lot of heat which is generated. It is also giving you a lot of nicotine, which is actually which stops healing processes. So nicotine in itself is bad for your health. Not only that, the gums and the surrounding bone tissues will get receded because of the nicotine. So smoking is no. Most of the time we should stop smoking. Otherwise what happens is your gum issues and gum problems will increase, although you might be seeing just the stains. If it is just the stains, still it is an unsightly thing, because if you are a smoking person, everybody will know that there is a lot of stains and you will look very ugly. But more than that, if you lose the tooth itself by gum problems, then that is an even worse condition. So please stop smoking. Now the other one is actually pan chewing. In India we have a lot of people who are using pan, and now it is getting into even the international countries that pan is becoming a international dish. But if it is used regularly on a regular basis, and if you are using tobacco for chewing pan or using arak nut and things like that, you can develop cancerous lesions, and also there will be loss of enamel and stuff, which is very bad for the tooth. Cancer is one part of it. The other side is actually the tooth, which is getting worn off and things like that. Cancer is very bad. You might get problems in opening the mouth. You might get a white lesion which is precancerous. If you find some of these, please go to your dentist and get it checked, and if at all required, you can go to the oncologist and get it corrected. Now so all these habits which are actually using all these intoxicants should be stopped as early as possible. Now what are the other things which are actually giving you trouble on the teeth? We may include using of wind organs like wind pipe and things like that. Wind pipes where you use it as a musical instruments. If you are trying to hold on to it using your teeth, then you can get an open bite. You might lose the enamel on the front teeth and you will get an open bite. All this has to be corrected by stopping the habit by itself. And second thing is, you might have to go for specific treatments. About the specific treatments, I will come up with another video wherein you can look into it, how we can correct all the problems which I have been telling about the open bite, about the chipping of enamel, about the loss of vertical height due to bruxism. All these things will be dealt in the next video. So keep on watching my videos. Please subscribe and understand more about dentistry and dental procedures. with all these videos which is there on Wikidontist and in Pallu Doctor in Malayalam also. So please watch my videos. If you have a friend who is having this habit, please send it to him so that he can stop. He will be encouraged to stop so that he will save your smile and also save his health from getting deteriorated. Dr. Thomas Nechupadam from Nechupadam Dental signing off for today. Thank you.
Wikidontist.com. Truth about tooth.